So Waterhealth International is what we call a next generation water company. We essentially build decentralized water purification plants, and we use and deploy them in communities across Africa and Asia where they don't have drinking water. The goal is really to address the core problem of access to clean, safe drinking water. So a lot of the MDGs talk about access to water. We really talk about access to quality, safe drinking water. So that's a big difference in our main mission as a company. And the way we do it is we identify communities that have the need. We work very closely with the community members. So for example, we work with the chiefs in Africa, the locally elected officials. We get their buy-in in terms of the project. And once we have that buy-in, we install the facilities, and then we actually sell the water to the community, which is another big difference. We're one of the few companies that actually generate income directly from low-income consumers, but we charge a very low price. It's about 10 to 12 US cents for 20 liters of water. So it's about just over half a cent per liter. And we find that translates to about 2 or 3% of their income for safe drinking water for the family on a daily basis. And what we find is that people are very willing to pay for that water because they know it's safe, it's reliable, it's there every day, and they can get it when they want. So it satisfies their demand, and also it's accessible from a location that's close to their houses. Number one is we make sure we identify communities that are accepting for our business model. We have a fairly rigorous, what we call feasibility process, where we go in, we look at the community, we make sure we get for example, a plot of land that's very central in the marketplace. It's not off to a side, so there's a lot of foot traffic, which can obviously generate demand. So we do a lot of upfront work in making sure that the community structure is suitable for our model. So that includes some affordability levels. But once we go in, our whole business model is predicated on scale. So the more facilities we put in, the lower we can keep our price point down. In fact, our average overhead per site, which is how we measure profitability, actually goes down the more number of sites that we have. So we ensure the scalability, the org structure, the way we manage and maintain our facilities. We try and manage the cost component of that, so we keep the final price down. What we call a big ambitious goal is really to do 100 million people by 2020. So that's our target. Obviously we need to grow much more than we are right now, but the business plan that we have accounts for that growth. So that's really our long-term goal. The challenges are multifold. So at the very operating level on the ground, the challenges are when you first set up a facility, just acquiring land, acquiring the permits, because we do everything legally and with the community. So we actually sign a contract with them saying we're going to operate the facility for 15 years. So if we want to do that, then we have some issues around accessing land, getting water permits, environmental permits, etc. So we work through that entire process. So that's on the ground level. And then as we move up the chain, getting people is always a challenge in these markets. Working with the government is they're very supportive, but it always takes a little bit longer than you like. Financing, one of the biggest constraints we have is, if you want to grow to that 100 million number, it requires some capital. So we're always in capital raising mode. So those are some of the challenges that we face. Once we identify a community that we like, we identify the leaders in the community. So this could be influencers, the chief or the local community elected officials, then government elected officials. We explain the process of what the project's about, what the benefits are. Once we get the buy-in, then we work at the community level. So that's with the schools, the community meetings, the We get volunteers from the community. We work with the religious organizations, the health centers there, to spread the message in terms of what's coming up, what the project's about, what the benefits are, etc. So it's a very holistic way of working with the community. And then once the facility is up and running, we also do a lot of social marketing. So we continue the initiative going forward to convince people to adopt our water versus the impure sources that they've been using. The main thing is, if you want to include governments in the equation, I think it has to be at the ground level, right? We've had, we meet a lot of government officials in environments in New York and Washington, and meetings always go well, but you have to get down at the very grassroots level to really make a real impact. So for a company like ours, working with the local government, water is a very local business. So even, for example, in Nigeria, the central government has no real jurisdiction about providing water at each community. That's the local government's responsibility, and they actually push that down to the local community. So that's where we really need to focus on, is locally, which is not an easy task because it's obviously very spread out, and so you might need to pick your locations or pick your geographies where you want to operate it. Well, I think it depends a lot on what they're trying to do, but I think social entrepreneurship, again, it's very local. The only way you get to the types of consumers that you're targeting is at the very local level. So you have to be ready to, go to the communities, interact with them, really understand the needs and the problem that you're trying to solve. So I think the problem definition needs to be very, very clear. And then, you need to build a business model around what the consumer needs, not what you think they need. So again, that requires a lot of understanding of, the demand and also the economics of the business and how you build it up. But again, very, very local.